My name is Blase Carabello. I'm the chairman of cardiology at the Mount Sinai Beth Israel Heart Hospital. As a cardiologist, I specialize in cardiac problems in general, but my own specific interest is in valvular heart disease. American College of Cardiology and American Heart Association are two of the leading cardiac associations in America and in the world. They, in turn, are able to appoint cardiologists and others, cardiac surgeons, anesthesiologists, to help develop guidelines that help other physicians practice medicine up to speed. The guidelines are aimed at the proper practice of medicine. The AHA-ACC have guidelines for, I suspect, at least 25 disorders. One of those is valvular heart disease. The AHA-ACC guidelines in general have been around at least since 1990. The first guideline that I was involved in was published in 1998, and the last one just this year in 2014. There are 4 valves. They either stick or leak, and there's really a guideline for all 8 of those. Valves are mechanical structures, and when they fail, they create mechanical problems, the only real solution for which are mechanical. That is, the valves either need to be repaired or replaced. Medications are a very small part of the guidelines. The first thing is to assess severity of disease. We do not believe that mild or moderate valvular stenosis, that either the valve is sticking or leaking, causes much in the way of problems. If the disease is severe, has it caused the patient any symptoms? Is it slowing them down? Is it causing them to get out of breath or to have chest pain or to feel like they're going to black out, depending on which valve we're talking about? If symptoms have already occurred, it's time to get the valve fixed. The guidelines really address now very directly the difference between replacing and repairing valves. The most reparable and the valve for which we have the most data is the mitral valve. We say as part of the guidelines that people with a leaking mitral valve should be referred to a center of excellence, a center where they are used to repairing these valves and where they have the skill sets to repair them. But if I were a patient and I was referred to a heart surgeon, I'd want to know what his or her track record was. How many of these do they do a year? What's the response rate? What's their mortality rate? What's the long-term outcome of these valves? I think it is important for the patient to take an integral part in their care. And one of the ways they can do that is to learn about the guidelines. It's easy to go online and look them up. They're written for physicians, so some of the technical language might be difficult, but they're pretty understandable. And so I think the guidelines, although written to help the physician care for the patient, they're also written to help the patient care for himself.